Our next speaker is Ms. Naomi Poole. She's the Director Partnering with Consumers Program at the Australian Commission on Safety and Quality in Healthcare, and that's also known as the Commission, as we mentioned earlier. In this role, Naomi is responsible for the Commission's work on consumer engagement, health literacy, and also shared decision-making. She also leads work in developing national safety and quality policy, bless you, and guidance on comprehensive care, end-of-life care, also recognising and responding to clinical deterioration. Naomi has a background in psychology, around 15 years experience in the development and delivery of national health policy, guidelines and standards. She's a very talented lady. We're very, very grateful that she's here with us today. Please welcome Ms. Naomi Poole.
Thank you. That's quite a welcome. So I'm just here to talk to you today about health literacy. Sorry, I'll make that a bit closer. And give you an idea about kind of what it is, explain in kind of simple terms what we're talking about, and then also give you a bit of information about what we've done so far and where we're going in terms of national policy around health literacy. So to start with, I'm just going to give you a little bit of background about the Commission, because I'm not sure if many of you are familiar with the Commission. We're one of those national organisations that is fairly quiet. So probably the area where you've most heard of us is when it comes to the National Safety and Quality Health Service Standards. That's one of our key programs, and we develop the standards. So how we've come about is we were established in about 2006. What happened is there was a review of safety and quality across Australia, and a number of recommendations came out of that review, one of which was to establish a national organisation to provide a bit of leadership around some of the key safety and quality issues. And also to have a look at the accreditation system for health services and see how we might make improvements there. So we're a bit of a unique organisation in that we are a federal organisation, but we're funded by both the Commonwealth and the state and territory governments. And what that means is that a lot of the work that we do is reliant on us actually coordinating, collaborating, working in partnership with each of the jurisdictions. And it's also about making sure that what we do doesn't duplicate the work across the states and territories, but we aim to complement what's happening in each of the jurisdictions. So what is health literacy? So it's one of those terms that's used for a whole range of different things. So it's talked about it in lots of different ways, both negative and positive. So people talk about it like it's a barrier, or sometimes it's talked about like it's a solution to a problem, or a byproduct or consequence of good health, education and social policy programs. So a few years ago, Sorensen actually did a review of health literacy, of the term health literacy, and identified there are actually 17 different definitions that were currently in use and 12 different conceptual models. So it's kind of no wonder that people are a little bit confused when you talk about health literacy. And the different definitions and models have come from different areas. So some of them are from a health promotion area and population health area. Some of them have come from education. And so they're all slightly different. And traditionally, a lot of the definitions have focused on individual skills and capacity. So they're talking about it as a person's individual health literacy. However, there has been a lot of work over recent years, and we now recognise that the other part of health literacy is actually about the complexity of the health system and the demands that it places on people. So it's a combination of those two factors. So we all know the healthcare is complex, so the system's complex. So trying to work out what to do to stay healthy, who to see if you have a problem, which advice to take, and how to find a service is really quite hard. Health services themselves are complex. So how do you find your way in a hospital? What do you need to do before you get there? What happens when you get there? And then what do you do once you get home? And there's also way too much health information out there. Some of it is fantastic and some of it is atrocious, but trying to navigate your way through and work out which is good health information, which is useful and which is valuable is really quite difficult. And it's particularly hard for those who are unfamiliar with the Australian healthcare system and for whom language might be not their primary language. English might not be their primary language. And of course, speaking of language as well, is that each different healthcare profession, different type of service, uses their own language as well. So there's a whole lot of jargon and terminology that can be associated with a particular health service or a particular profession that can make it really difficult to understand, even if you have a really high level of health literacy. So faced with this mass of options and pathways, even people who have a really good understanding of the system and healthcare concepts can find it really complex. So the way that we see health literacy is we look at it in two parts, as Janice has mentioned before. So looking at it in these two different ways actually makes it a little bit easier to try and work out where we can actually influence health literacy and contribute to improvements. So you can do things that focus on improvements at individual skills, knowledge, motivation and capacity. And so things like health promotion programs and education programs can support improvements there. And you can also support improvement by changing the health literacy environment. So having a look at, it could be the physical environment or health information, and making them easier to navigate and understand. So looking at health literacy, we're not going to be able to reach a point where everybody's individual health literacy is perfect, and we're not going to be able to shift our system completely to a point where it is really nice and simple and easy to understand. So it's about finding a balance between those two areas. So that people know where to go to get good quality information and the services that are right for them, so that people have a better idea about how to judge the information that's out there, so that they can understand the options that are available and share decisions about their healthcare with their provider as much as they want to. So we want to move away from thinking about it as health literacy as being an individual deficit and thinking about it more in terms of reducing the mismatch between the complex health system and an individual's capacity to understand, use and act on information about health and healthcare. So we've already talked a little bit about the statistics. So I'm sure that you've probably seen this statistic around for quite a while. So this figure comes from a study that was done by the ABS, so the Adult Literacy and Life Skills survey that was done in 2006. We've only ever done it once in Australia, but we're actually in the process now. The ABS is looking at different ways of measuring health literacy in a survey that will be rolled out towards the end of this year. But as an indicator, it gives us an idea about the scale of the problem. So, and unsurprisingly, people who speak English as a second language have an even harder time. So as Michael mentioned, 75% of people whose second language is English have a low individual level of health literacy compared to 60% of the general population. So there are a range of factors that can influence health literacy. So things like age, education, disability and even gender actually have a part to play in variations in health literacy. But culture and language is often a strong influencer, both for Aboriginal and Torres Strait Islander people and also from people from culturally and linguistically diverse backgrounds. Because there are a number of underlying complexities that will interfere with accessing, understanding and using the system, including things like, obviously, English language proficiency, access to translation services, access to culturally appropriate care, and navigating the cultural norms and expectations which might be vastly different from their own cultural experience, which has a whole range of other linked factors associated. So, but why does it matter? So, health literacy is important because it affects how people make decisions about their care and how they take action to manage their care, both whether or not they're a patient within a health service or whether or not they're just living their day-to-day lives and making everyday decisions about their health and well-being. It also affects the way clinicians manage their relationships with consumers and deliver healthcare, and it also affects the efficiency and effectiveness of the system as a whole. So there's a whole range of studies that have looked at health literacy and have found that those with lower individual levels of health literacy have poorer outcomes and a higher risk of adverse events. And in fact, it's been estimated that people with a lower level of health literacy are 1.5 to 3 times more likely to experience an adverse event. So it's very much about the safety and quality of healthcare. And there's also the potential economic impact, both for the individual and for the system. So in the US, they did a project where they were looking at trying to estimate the cost of health literacy. And for an individual, came up with around about $150,000 to $7,800 per year in additional costs for the individual, and also about 3 to 5% of total healthcare spending. So in Australia, we have been talking about health literacy for quite some time. So Don Nutbeam, who was mentioned before, has been working for a very long time in Australia talking about health literacy, raising the profile. And he was responsible for one of the first kind of policy forays into health literacy. And he set out some national goals and targets way back in 1993. And since that time, we've been incrementally improving our awareness and understanding of the impact and the importance of health literacy on healthcare. And in parallel to this, there's actually been quite a strong groundswell of research that's happened in Australia, particularly around the measurement of health literacy. So we're getting a much more nuanced understanding of how to measure it and how to actually integrate interventions at a local level to try and make improvements in that area. So in terms of what we've been doing nationally, so we started a piece of work around about 2013 where we were trying to work out how we could actually create a greater system understanding of health literacy and coordinate some action in the area. What we did is we did a background paper on health literacy which looked at what it was, where the evidence was for it and how it impacted on safety and quality, and then came up with a bit of a conceptual model about how you might be able to think about the different strategies that you can implement to address health literacy. And what we did and what we concluded was that if you focus on 3 different areas, you can actually create a bit of a movement towards health literacy. I think the emphasis and the critical part of addressing health literacy is you actually need to tackle it on multiple fronts. So there are a range of different types of strategies that need to be implemented. And what we focus on is embedding health literacy into high-level systems and organisational policies and practices. So making it part of how the system works rather than an add-on. And that doesn't necessarily mean creating a policy on health literacy, but looking at your policies that you currently have and seeing whether or not each of those consider health literacy and how you can actually enhance those to create a more systematic approach within an organisation or across the system. We also identified that focusing on effective communication is critical because health literacy and communication are incredibly tied together, and that you need to make sure that health information is clear, focused and usable, and that interpersonal communication is effective and does what it sets out to achieve. And we also advocate for integrating health literacy into education. So that's actually quite a large area because it's about education of healthcare professionals, people working within the healthcare system, as well as education for consumers and the community about the importance of health literacy and understanding information about the way the healthcare system works. So ensuring effective communication is about being sure that information is developed and tested with the types of consumers who use your service. So ensuring that when you develop information for your area, that you actually have a good understanding of who uses your service and people who are actually within your community but may not necessarily be using your service, so that you can reach out to those people. Making sure that information is available in a variety of formats so that people who have differing ways of learning have options to incorporate it into their health and care. And for culturally and linguistically diverse consumers, obviously it's about providing information that's easy to understand, and in many cases there's issues around associating or accessing translation and interpreting services and providing information in different formats. And ensuring effective communication is also about making sure that clinicians have the skills to be able to tailor communication strategies to different types of patients that they see, and making sure that strategies are used to check and confirm understanding. So there are lots of different examples of how this can be used in practice. So there can be integration of service-wide processes, development of different types of tools and resources to support communication, and use of teach-back and other types of coaching techniques to share information and confirm understanding. So when we're talking about integrating health literacy into education, so as I mentioned before, it's education on a number of different fronts. And so, for example, we can talk about integrating health literacy into formal education for clinicians. So there are opportunities for including it in undergraduate, postgraduate and continuing professional development. And part of that is about providing an understanding and information about the impact of health literacy on their patients, but also part of that is about providing the support and education tools and resources so that clinicians feel skilled and have the capacity to use the different communication techniques that might be required once they're in practice. And then there's also education for consumers and community. So providing information to consumers and community about the healthcare system, how to find health information, how to use health information, and how to make critical decisions about healthcare for themselves. So there's been quite a lot of work undertaken over the last few years in this area, particularly around integrating health literacy and education about the healthcare system into school curriculum, and also into programs like TAFE programs. And of course, health promotion programs are a core part of providing education about specific healthcare conditions and also about accessing health services and the programs that are available to parts of the community as well. So there are lots of different examples about how that might work. So developing health promotion frameworks, delivering health promotion programs, and educating and training staff in communicating techniques and strategies. So I'm just going to talk a little bit about health literacy into systems. So there are lots of different types of systems. So there are the cross-sectoral systems, but there are also the local systems that work as well. So there are lots of different avenues that can be used to influence health literacy in this way. So at the higher level, we're talking about things like looking at different funding mechanisms and how you can influence those to encourage awareness and action on health literacy. You can also look at different regulation and registration requirements for professionals, and things like the standards that the Commission looks after is one way of trying to influence health literacy, which I'll talk about next. And at a local level, there are lots of different ways that you can integrate health literacy, whether or not it's using those words or in other ways, into policies and programs, so that the consideration of how information is communicated, how interpersonal communication, how information is provided to consumers is actually thought of in a critical way. So I'll just talk a little bit about the National Safety and Quality Health Service Standards. And the reason I'm going to talk about this is because this is where we've taken health literacy as the next step. So we've done a lot of conceptual work around health literacy and described what it means. And we did a health literacy statement that we provided to health ministers, and all health ministers agreed to it and said that this is a really important national problem back in 2015. And then at the same time, what we were doing in around about 2014 and 15 was looking at the Safety and Quality Health Service Standards and reviewing the first iteration that was out in the system to see where we might actually make improvements and enhancements in a second edition. So what we've done is we've actually integrated all of the things that we've learnt about health literacy into the second edition of the Safety and Quality Health Service Standards. The new version is actually due for implementation from January 2019, so it's quite timely to be talking about it right now. So in the first edition of the standards, there were a number of items sprinkled throughout the standards which talked about providing information to consumers that was easy to understand and use. But in this second edition, what we've done is we've pulled that all together, so it's a much more overt approach to health literacy. So in the second edition, there is an action in Standard 1 which talks about signage and wayfinding and making sure that health services provide an environment for consumers that is easy to navigate. In Standard 2, we've pulled together all of the actions that focused on health information into one criterion, which is specifically called health literacy, and has a whole set of new requirements around that. And then it's also worth mentioning that Standard 5 has a number of actions in it, which is the Comprehensive Care Standard, which talks to sharing decisions with patients about their care, identifying the goals of patients' care, and planning and involving support people in a collaborative approach to care delivery, which is all dependent on effective communication with patients and their support people, which again is reliant on health literacy. So looking at the criterion that we've actually called health literacy, which is the most overt part of health literacy in the standards. So this is part of the Partnering with Consumers standard now. And what we're saying here is that health services need to understand the diversity of their population who use the service, and then they need to tailor information to meet the needs of that diverse population. And health services also need to support clinicians to communicate effectively at the point of care. So from January 2019, these standards will become mandatory, and there's a much greater requirement to think about and address health literacy in a systematic way, and to take steps to reducing the complexity within a health service and tailor information to meet the needs of the people within your community. So, quick plug. As I said before, this is not a new thing. We've been talking about this for quite some time. There are lots of people working in this field. Many of the health services, including South West Sydney, have been working for a long time on engaging in partnerships with consumers, improving communication and addressing health literacy in a variety of ways. So it's not starting from a green field. And the Multicultural Service has developed this toolkit for this week, which has a lot of really useful tools and resources for health services and for clinicians and for consumers to start thinking about how we can actually improve and support health literacy. There are also a range of other different types of resources out there as well. So the New South Wales Clinical Excellence Commission has developed a guide for health literacy. At the Commission, we've done a lot of different types of fact sheets and resources, some for consumers, some for managers, and some for clinicians about what they can do when thinking about addressing health literacy. And one of my favourite ones is the Agency for Healthcare Research and Quality has a Universal Precautions Toolkit for Health Literacy, which is an incredibly practical toolkit if you are looking for a place to start. So just in summary, health literacy is a safety and quality issue. It affects people's health outcomes and people's health experience. It's also intrinsically linked to communication. There's so much overlap there. A lot of it is about communication. It's about information that's provided both verbally, written on your website, when you walk into a health service. So it's about how that information and how communication of information impacts on your experience and your decisions as a consumer. And consequently, it's incredibly important for people from diverse backgrounds and culture because there are so many additional barriers that lie within there. There are many, many small and large things that can be done to make it easier for people to understand the system and to make the best healthcare decisions. And we can all take steps either as consumers, clinicians, managers or policymakers to actually contribute to improvements in this area and to make sure that we're supporting people to experience safe and high quality care that's tailored to their individual needs and addresses their individual concerns and experience. And that's me. Thank you very much.